Hello, hello everybody! I am back on YouTube with another medical education stream. Oh no, am I getting disconnected? Oh wait, yeah, I got disconnected a while ago, but I'm back. I am back! How's everybody? How's everybody? Hello, hello, let's see who's here. Recycled Cabbage, hello Zanze, hello. Oh god, wait, there's a lot of you. Pineda, hello. 3 a.m. raid, hello. Fapmaster, hello. My name is Garci, hello. Suguitan, hello. Leonair, hello. Clemon Cruzan, hello. Brilliant Anino, hello. Ryan, hello. Chadomatsu, hello. Silas, hello. Daedalus, hello, hello. Hello, guys. Okay, this is gonna be the last medical education stream of the year. So, wait. Let me open up the PowerPoint. We're gonna be talking about hernia. No Man's Land, hello. Hello, hello. We're gonna be talking about hernia. Let me, hold on. Eh. God, I'm still not adept, or I mean, not familiar with YouTube. I need to... Wait, let me fix... Okay, let me just open up the PowerPoint. This time, I did not cram my PowerPoint. Silas, I did not cram my PowerPoint this time. I actually worked on this earlier. I actually had time to work on it. Musta Doc. Hello, oh lunch. Drac Black, hello. Hello, Bucket, hello. Hello, Shinjo Hajime, hello. Hello, okay. Alright, here we go. Let me just, Oh, shoot. Let me just set up the PowerPoint. Oh, wait, what? Wait, why is this? Alright, there we go. There we go. Okay. Di na ba cram? Oh, no, I did not cram this. I did not cram this one, actually. I did not cram this one. Are you going to use bread as sensor bar again? I always use bread as sensor bar. It's like the perfect sensor bar for me to use. Patrick Garcia, hello. Good evening. Hello, hello. Okay. Well, let's get started. Okay, hold on. We're gonna be talking about hernia. Let me just, Ha. Alright. We're gonna be talking about hernias. You guys know what hernia is? Oh, hello, Chips. Hello. Welcome to my hernia stream, my medical education stream. I'll be talking about hernias. This topic is interesting. I'm kind of scared because I probably have... Oh, you have a hernia? Really? Okay. I'm going to talk about hernias. I'll probably go through very quickly the different types of hernia. The ones I will talk about or briefly mention, because there's many kinds of hernias. I can't talk about all the hernias that exist in one stream. In one short stream. Okay, there's a lot of hernias. There's like abdominal hernias, there's diaphragmatic hernias, there's inguinal hernias, femoral hernias. There's even brain hernia, but you know, there's a lot, and I can't talk about all of them. So I'm gonna go for the most common one, which is more on inguinal hernia. Yeah, I will talk. What is hernia? I will talk about that. Don't worry. In Tagalog, it's lus-lus. Yeah, if hernia is lus-lus in Tagalog. In Filipino, it's lus-lus. Yeah. Okay. Yeah, there's a lot. There's a lot of hernias, but I'll just talk about the most common ones. Okay. Wait, I have a tablet here that I can use. I'm gonna use my pen tab. Because I'm gonna end up drawing. I might end up drawing on the... Wait. On the PowerPoint presentation. I can't find the pen. Where's the pen? Oh no. Where's the pen for the hernia? For my... Wait. Oh my god, I can't find the pen. Oh, here it is. I got it. I'm gonna be using my pen tab for this. Because, I might have to draw on the slides. Let me fix this. Okay. Sexy naman ang video niya. Hey, actually, you know what? This background, you see? This background is a one of the duckies that I had, but this is not the one. This is like one of the old ducky what do you call this? Ducky Makura art I got. Anyway, let's go. What is a hernia? So this was Silas's question a while ago. What is a hernia? So, a hernia is when an internal organ protrudes through a weakness in the wall of muscle or fascia. So if you look over here, let's go draw some. Let's draw. Where's the drawing thing? Pen. Alright. If you look here, see this? This is a fascia, this white thing. This white thing is the fascia. This is... the muscle is in between. Okay, there's supposed to be muscle. Sometimes there's muscle in between the fascia. So it's a weakness. And when there's a weakness, it would... you would have a hole. And that's when abdominal contents protrude out. So yeah. Okay, you can have intestines. Usually it's intestines protruding out, or the fat. This one, the fat protruding out into the hernia. So the hernia is just the hole or the weakness. Okay. How do you erase all ink? There we go. Sounds like pain. Yeah, it can be painful actually. All right, so that's what a hernia is. Okay. Alright, next. So here's some of the different types of hernias. This is only a few. This is only a few out of the many types of hernias or kinds of hernias there are. So, one of epigastric hernia is a hernia that occurs in the epigastric area of the abdomen, which is here in the upper abdomen. The middle upper abdomen is called your epigastric area. And umbilical hernia is a hernia that occurs at your belly button. Umbilical means umbilicus, which is your belly button. So you can have a hernia in your belly button. Usually these are congenital. Like you could have them when you are a baby, and they just grow. And the most common one is the inguinal hernia. It's here. You can have it on the left or the right. The inguinal hernia is the most common one. Femoral hernia is also in this area, but below the inguinal canal. I'll be showing that to you later, the anatomy of that later. Images you can feel. Yeah. There's also such a thing as incisional hernia. An incisional hernia... let me erase this, hold on. Let me erase what I drew. There is such a thing as an incisional hernia. So, for example, you underwent an operation. Let's say you underwent an appendectomy where your incision would be like this. Your incision would be here. And an incisional hernia is when you developed a hernia in a previous site of operation. So, if, for example, you got an appendectomy done, your incision is here. And then years later, you develop bulging here, a hernia. That's called an incisional hernia. It can happen on any operative site in the abdomen. Like if you underwent an exploratory laparotomy or your incision is here, and you get a huge bulge in the middle of your abdomen, that's a hernia, incisional hernia. It's not just congenital. Yeah, it can be acquired. A lot of hernias are congenital, especially in the inguinal. Usually congenital. But we can also get acquired hernias, and I'll tell you why you get hernia, even if you don't really congenitally have a hernia. Yeah. Hello, iMac. Hello. Alright, let's erase that. Okay. Anatomy. Anatomy of I'm gonna be talking about the inguinal area, okay? Because this is the one we're gonna be talking about more. So, this is kind of complex because, to be honest, even I have problems with the inguinal area. This is a very complex anatomy. So I got some photos to help me out here, because this is actually very complex. It's not easy. It's pretty complicated, this area. Alright, let me change my pen. Alright. So... oh shoot. Oops. Wait. Alright. Over here on the left side, you can see the different layers of the abdomen. Yeah, I'm telling you, this is complicated. I try to simplify it if I can. It's not easy. The innermost layer of the abdomen is your peritoneum, and then you would have the one next one on top of it. This is in the inguinal area, okay? Peritoneum, you'll have the transversalis fascia. Alright? Then you'll have the transversus abdominis muscle, and then you have another two muscles here, which are the external oblique and the internal oblique muscles. These are the layers of the abdomen, and then after the external oblique is the fatty tissue and then the skin. Okay? The inguinal canal is here. Here. This one over here you see over here is the pelvic bone. The lesser part of the pelvic bone. This is the inguinal canal. By the way, guys, this anatomy is more on the male. Okay? This is a male anatomy. Because mostly, it's usually the males who get this inguinal hernia. There are females who get it, but majority is male. So, usually when they show anatomy of the inguinal canal, it's always a male anatomy. Doc, may quiz po ba mamaya? Pwede. So, you see this here. This is like an X-ray view or a see-through version. The inguinal canal is here. And within your inguinal canal, you have the spermatic cord. Okay? For spermatic cord contains a lot of structures. Like blood vessels for your testicles. And the most important one for you all is the vas deferens. The vas deferens is the tube wherein the sperm passes through. Okay? If that ever gets cut, if your vas deferens gets cut, you can't, you'd become infertile. Yeah. Quiz mamaya 1 to 100, passing 99. Grabe naman, brutal naman na. Passing 99. Wala, mangungopia. Hi, bawal mangopia. Alright. So, structures, when we're doing a hernia surgery is easy, but it can also be kind of complicated. There are blood vessels you wanna avoid when doing a hernia surgery, and it's these two big blood vessels right here. Oh god. Ang mangungopia mababasectomy. Actually, that's what a vasectomy is. That's why it's called a vasectomy. It's when you cut the vas deferens. Okay? It's when you cut the vas deferens. Did I get... Oh god, I got disconnected again. Why? Why? No, I got disconnected like for a while. Okay, next. So, there's this thing. You can see there's like a little drawing here called the Hasselbalch triangle. This is important. We use this to identify... There's two types of hernia, the direct and indirect hernia, which, wait, I will show you. I think it's in the next slide. Let's go to the inguinal hernias already, okay? So, this is a hernia. This is what is an inguinal hernia? An inguinal hernia is when you have a defect in the inguinal area. I showed you in the inguinal canal, right? And that's where the contents of the abdomen will pass through. The inguinal canal. So you can see this one is an intestine. Some intestine passing through the inguinal canal. Sometimes it can reach the scrotum. That's why there's some people with an inguinal hernia wherein their scrotum gets really big because the contents fall into the scrotum. Okay? It can happen. Like sometimes hernias just stay in the inguinal area. But if it's really, really big, they can enter the scrotum and reside next to your balls, basically. You can feel it from the... Yeah. Alright. Next slide. Oh. What am I next? Alright. Direct inguinal hernia. Okay. Remember a while ago I was talking about that there's an Hasselbalch triangle? This is the triangle right here, okay? The triangle is here. It's bounded by the rectus abdominis muscle, the inferior epigastric vessels, and this one, inguinal ligament. Okay? If your hernia protrudes here where this bread is, if your hernia protrudes here where bread is, it's a direct inguinal hernia. Okay? So if it comes out, if it bulges out here, it's a indirect hernias. Oh god, am I getting disconnected? Wait, why am I getting disconnected all the time? What the heck's happening? Online class. Online class moment. Okay. I'm back. I'm back, guys. Am I back? Am I back? Fuck Converge. Walang quiz mamaya. I'm back. I'm back. Okay, as I was saying, guys. Bread is just a marker on this image, okay? If the hernia passes through the triangle, it is a direct inguinal hernia, and if it passes outside the triangle and through the inguinal canal, it is an indirect inguinal hernia. Indirect inguinal hernia is the most common one I see. It is a most common inguinal hernia. Okay? Okay. And then femoral hernia occurs below the inguinal ligament or the inguinal canal. This one is usually in females. I've seen very few of femoral hernia. I usually always see indirect inguinal hernia, and it's always in the males. Femoral hernias are usually in the females. Okay? Alright. I hope you guys understood that. Converge. Yeah, Converge is being shit. Anyway, it should be good now. Okay, here we go. This slide compares all the types of hernias. I just got this photo, copy pasted and censored, you know. Here is censor bread. Well, say hello to censor bread. Okay, so indirect inguinal hernia, like I said, is the most common. The most common one. This is often in children because indirect inguinal hernias are actually congenital. Okay, it's actually congenital, and they can present later on. The direct hernia is more on acquired, and it's usually in older men. Okay, very rare in women. Femoral hernia is more common in women. Okay. So, indirect hernias, like I said, since they pass through the inguinal canal, they can enter into the scrotum. Direct hernias don't really do that. And femoral hernias, since they're at the bottom of the inguinal canal, they don't really go inside the scrotal sac either. Okay? Cargador. Alright, next. Alright, risk factors for hernia. So, what increases your risk for hernia? Like I said, inguinal hernia is more congenital. You're just born with a weakness in that part of your abdomen. And eventually, you can present with a hernia while you're a child, or you can present with it later on. Most of the time, I would have patients who've had a hernia detected when they were children, but then they don't get surgery. And when they get older, the hernia, the abdominal contents already fall into their scrotum. The way God nerfed you when you were born. You got nerfed when you were born. Okay. Risk factors. Alright, so one of the risk factors, okay, these are not exactly the causes, but if you have any of these and you have a hernia or a weakness in your abdomen, you are prone to develop a hernia, okay? These risk factors can go for inguinal hernias or any type of abdominal hernias, okay? So, F for the ponpon buhat. One of the risk factors is obesity. Obesity or overweight. If you're fat, you have a chance of getting a hernia. Okay? Unfortunately. More on like really obese. Yung obese talaga. Not really, not all fat. Doesn't mean that if you're overweight or, fat, that you'll have a hernia. But you're at risk for it. Okay? If you're obese. Alright, next. Constipation. Constipation is another risk factor. You're sitting on the toilet. You try to poop. But your poop doesn't want to come out, so you start forcing it. So, you're at risk of getting a hernia, and not only that, you're at risk of getting hemorrhoids. I think Chips tweeted something like a while ago about not being able to shit. I saw that tweet. Is Chips here? I saw that tweet. I saw that tweet. I actually replied to it. I said, baka magka-almoranas. Okay. So that's another risk factor. Bro, why are you exposed? It was tweeted. You tweeted it. Twitter is public. People will see that. Shit's the light. Shit's the light. Okay. Okay. Anyway, yeah. Next. This one is more on older people, but if you have an enlarged prostate, you have a higher risk of developing hernia. Why? Because okay, let me show you. This thing right here, the sad face, is your urinary bladder. Your urinary bladder is crying because your prostate is large. Okay, this is a male thing. When your prostate is enlarged, what happens is it constricts the urethra. This is the urethra, or the path from the bladder to the outside world. To the outside. This is where your piss comes out. Okay. So if it constricts this, your pee can't come out, right? Or you have a hard time urinating. And when you have a hard time urinating, you start to strain, just like when you're constipated. But instead of constipation, it's more on difficulty urinating. Okay? That's why some guys with enlarged prostates develop hernia. Okay. Alright. Next. Next is pregnancy for women. Okay, pregnancy. Because the big baby starts pushing, when you have a baby in your uterus, and your uterus gets big enough, you start pushing everything inside your abdomen. You get a higher chance. You have a chance of getting a hernia, and also hemorrhoids. All right. Wait, what? Wait, what? Why are you're massaging your prostate? How are you? Wait, that's very sus. That's very sus. Why are you massaging your prostate? Oh god. Okay. Next. Alright, weightlifting. Yeah, for all those weightlifters out there, you're also at risk of developing hernia if you have a weak abdominal wall. Yeah. Okay. Doesn't mean that if you're a weightlifter you're going to have a hernia. It just increases your risk, especially if you have a weak abdominal wall. So yeah, weightlifting. Now, what do all of these have in common? All of these have one thing in common. They have one thing in common that causes or increases your risk of developing a hernia. And that is, for example, in weightlifting, in pregnancy, in difficulty urinating, constipation, obesity. The common denominator there is that it increases the abdominal pressure. Okay? Like when you strain, you're increasing the pressure in your abdomen. So when you increase pressure in your abdomen, If you have a weakness there, then whatever's in your abdomen tries to bulge out because of the increased pressure. That's actually why. Is the common thing force and pressure in the abdomen? Yeah, that's what it is. Pressure. So that's what, if you have a weakness and it's inborn, like an indirect inguinal hernia, and you put a lot of pressure on your abdomen chronically, that's when the hernia develops or gets bigger, and then whatever you have inside your abdomen bulges out. That's why when I have patients who I have patients who say they don't have a hernia. They don't have a hernia, but then suddenly they just lifted something, and then there's like sudden bulging in their inguinal area. Like I had one patient last month. He lifted some packages from Lazada. He works in Lazada, and he just suddenly got a hernia. It suddenly bulged out and then went into a scrotum. There's some people, like mostly yung mga lolo or the old men, they have constipation for quite a while or difficulty urinating for quite a while. They slowly develop a hernia. It bulges first in the inguinal area, and then like sooner or later it reaches the scrotum. They just don't do checkups right away because it doesn't bother them. Apparently, it doesn't bother them that they have something bulging all the way into their scrotum. And they only do checkups when it hurts. I don't know. Matiisin talaga yung mga tao. Alright. Hilig ka pa naman magbuhats ng grocery. Yeah. So, yeah. Lazada pa kasi. Okay. Okay, wag na tayo magbuhat. Grabe naman. Yeah, pain tolerance. There are some people, they already had the hernia for years. It was already bulging in their inguinal area, but they don't do a checkup because the bulge disappears when they lie down on their bed because they're lying flat. So whatever was bulging there goes back inside. And then when they start standing, it bulges again. Sometimes it gets worse through the years that it reaches their scrotum. And even if it reaches their scrotum, they still don't do a checkup because it doesn't bother them for some reason. Parang, ewan ko. Hindi sila nabibigatan, ewan ko. For some reason. Most of the time, they come for a checkup when it starts hurting. Or when they can't put it back. So those are called reducible hernias, if they can put it back. Okay. Next. Does Kegel help? Kegel is for pelvic muscles. That's far away from an inguinal hernia. Okay. Next. Alright, complicated hernias. Or baka walang pera magpa-doktor. Pwede rin. But kahit wala silang pera magpa-doktor, if they're in pain, they will go to the ER even if they don't have money. Because they're in pain. So it's more like they just don't feel anything. Okay? So next, complicated hernias. This applies for all types of hernias, by the way. Okay. Hello, Joshua, Dave Deason. Hello, Neil Boy, John Yutok Tobe. Oh my God, that's a full name. Hello. Question po, Doc. Can a hernia heal by itself? No, it can't. It cannot. A hernia is treated surgically. So once you have a hernia, you need a surgery. Pwede ba magka-testicular torsion pag may hernia? It's not really related. Testicular torsion is different from a hernia. But not really. You mean you don't really get... You can get testicular torsion if your balls twist in its from its root. So complicated hernias. This applies to all types of hernias, inguinal or the abdominal types, the umbilical, epigastric, etc. So, what is incarcerated hernia? What is incarcerated hernia? This is when the hernia, whatever is bulging into the hernia, becomes trapped and you can't put it back. So, abdominal contents are trapped and cannot be reduced back into the abdomen. These types of hernias need an urgent surgery, meaning once you have this, you need to have a surgery. It's not emergency, but you know, we would advise the patient to be admitted and have a surgery done, like as soon as possible. Okay, so let's put an example. The old men who tolerate their hernia for years, like they were constipated, they develop a hernia, it goes back. They don't consult because they feel comfortable. It goes back inside when they lie down, or they just push it back. It gets smaller. Eventually, if their hernia has been there for years, bulging out for years, and they don't do anything, it becomes incarcerated and trapped. And those are one of the reasons when they start checking up, because it becomes uncomfortable already, because the hernia doesn't, the bulging or whatever was inside the hernia does not go back, and they can't put it back. Okay? So, when we see something like this, we advise them for surgery. Sometimes it may look like an incarcerated hernia, but when you see a doctor, and sometimes if you see a doctor and what they do is they try to push it back into your abdomen, it's sometimes painful, but it helps. It helps if the doctor is able to catch it early and push it back into the abdomen, because the next slide after this is the most complicated hernia. Okay, which is the strangulated hernia. This one is an emergency. Strangulated hernia. So the intestine basically becomes strangled, or whatever is there. Abdominal contents become strangled. What happens is you lose blood supply to that area, to that part of the intra-abdominal content. You need an emergency surgery for this. Okay? So, sometimes when you have an incarcerated hernia, when we have a patient who comes with an incarcerated hernia, some doctors will try to push the hernia back in. Why? Because they want to prevent this from happening. They want to prevent strangulation from happening. Because if you have a strangulated hernia, the surgery becomes more complicated. It's not a simple repair of hernia. It becomes a bigger operation, actually. It becomes more major. Yeah. So, that's why. Is hernia deadly? Depends on the hernia. If it's strangulated, then yes, it's deadly. When we see our hernia pushes back into abdomen, the doctor will try to push it back. It's called taxis. They call the process of putting the hernia back, or whatever's bulging out back into the abdomen, as taxis. Okay. Alright. So, strangulated hernia is an emergency because there will be loss of blood supply into this part of the intra-abdominal contents. When there is loss of blood supply, for example, it's the intestine, right? If there's loss of blood supply in the intestine, then it doesn't get enough oxygen. And what happens when you don't get enough oxygen? You die. So that's what's gonna happen to this intestine right here. It's gonna die, it's gonna necrose, it turns black, and smelly. So what happens is you have to do a major surgery. Sometimes you have to take that part of the bowel out. All right. Taxis. Taxis. That's taxis. Taxis is Taxis. Okay. Let me write it down. It's taxi. Taxis. Wait, taxis. That's what it is. Okay. Ate Shioripon. Oh, hello, vendor-san. Hello, hello. Yeah, it's taxis. That's what it is. Okay. Okay. Next. Treatment. Okay. Plural of taxis, taxi. Yeah, it's called taxis though. Alright. Treatment for hernia. There are a lot of different types of treatments for hernia. Okay, there's a lot actually. So for children, it's called a herniotomy. As for pediatric patients, what you do is you just remove the hernial sac. So the picture here is it's a step-by-step procedure on what they do. So let's use my pen. Hold on. Over here. So this is like an open skin and fat. You enter the fascia. They cut this open. This right here is the spermatic cord with the hernia sac. So they open this. They get the hernia sac, which is this yellow one. They separate it from the spermatic cord. And then they open it and they ligate it. Meaning they tie a silk suture here at this area, and then they cut off the hernial sac. So it's basically removal of the hernial sac. That's a herniotomy. Usually done in pediatric patients. Alright? Pediatric patients. Baby hernias. Yeah, and babies or any children. Any young children. Okay. Hello, Dianjo. Hello. Alright, next. Alright, the next one is a herniorrhaphy. Herniorrhaphy is a herniotomy plus tissue repair of the posterior wall of the inguinal canal, or basically the floor of the inguinal canal. Okay? So we have bread here censoring the PP. Okay? So again, they cut open the fascia, they look for the spermatic cord, you separate the hernial sac, ligate it like in the herniotomy, take out the hernial sac, and then if there is a defect underneath, you repair that with sutures. And then you close the wound. Okay, that's a herniorrhaphy. There are many kinds of herniorrhaphies, by the way. There are different types of herniorrhaphies, and they all have their proper names. There's like a McVeigh repair, a Schuldeis repair, a Bassini repair. There's a what else? There's a Darcy's repair. There's a lot of repairs of hernia that I cannot put them all in one presentation because that is a lot. It's a lot. There's way more than what I just said. Okay. So the ones I've seen are the one I saw is a Bassini repair. Okay, it's a tissue repair, meaning you only suture it. That's what I mean by tissue repair. It's a primary repair. You just suture the defect. Okay. Sino si Hernia? Hello, bread. Hello, bread. Wait, you know what? I just realized I should like... Oh, shoot. May ano lang. Nurens Henry D. Hello, hello. Hello, everybody. Hello, new people. Okay. Hold on, let me just check something. Alright. Wait, how do I give a wrench to people? Oh, here we go. Let's give a wrench to... Where's Chadomatsu? Okay, I'm gonna give you a wrench. I found out how to give wrench. Okay, I gave wrenches. Okay. Next. Ang liit talaga ni Brett. He's too small for this purpose only, okay? Alright, next. Next one is hernioplasty. This is the one we usually use, okay? We usually do. This is the most recommended repair for hernia. A hernioplasty. So what is a hernioplasty? A hernioplasty is a herniotomy plus a herniorrhaphy and the placement of a mesh or a prosthesis. Okay? So you do the previous two. You're gonna... What happens is you open up the inguinal canal. Access the inguinal canal. Remove the attachment. Remove the hernial sac. Detach the hernial sac from the spermatic cord. Ligate it. And then cut it off. So you remove... That's a herniotomy when you remove the hernial sac. And then if there are defects underneath the floor that need to be repaired, that's when you suture it. And then after you suture it, that's the herniorrhaphy, right? You place a mesh. Which is on the left side. This is what a mesh looks like in real life. It looks like a net. It looks like a net. And then you place it as seen here. Yeah, you can add a mesh to a body. So the mesh is for reinforcement, okay? So as you can see on this photo here, the defect is here. You put a mesh so that the intra-abdominal contents doesn't bulge out anymore. The mesh reinforces. This is the gold standard repair. There's a proper name for this one, the one we usually do, and it's called a Liechtenstein repair. Let me write that down because that's a very complicated name. Liechtenstein repair. Where? Let me spell it out. Liechtenstein repair. Yeah. Yep, Liechtenstein repair. That's what it's called. Okay. There's also different kinds of repair like oh god, someone's knocking on my door. I'll be right back. Wait. Okay, I'm back. What are the... Liechtenstein. Does the whole body hole regen and close after the meshing? What do you mean? No, the mesh stays inside your body. Liechtenstein repair. The mesh stays inside your body. Okay. There's also another one called hold on, let me clear this. There's another repair which is called the For large hernias, there is one called oh shoot. Component separation repair. There's one called that. That one is very hard. That takes hours. It's for very large hernias in the abdomen. Not really an inguinal. It's for really large hernias, and it's very complicated to do because in this repair you have to slit the rectus abdominis muscles and to loosen the, you know, there shouldn't be a tension when you repair a hernia. There shouldn't be tension, okay? Because if there's tension, there's a high chance of recurrence. That's the reason for the mesh also. It reduces tension. And component separation, what you do is you slit the muscle so that it becomes more loose, so that when you close it, there isn't tension. It's a very complicated procedure. I've only seen like one or two of those. It's very hard. It takes forever. It takes hours. Okay. Alright. But yeah, the most common one is Liechtenstein repair. It's a tension-free mesh repair of the hernia. Okay. Next. Alright, next slide. Okay. Laparoscopic repair. So the ones I've discussed were all open repairs, okay? More traditional. We also have a laparoscopic repair. So, laparoscopy meaning minimally invasive. You just make 3 small incisions. For example, you have a hernia here. You just make 3 small incisions. And then from the inside, that's when you repair the hernia. You place the mesh from inside. Okay? This is a more advanced repair. But when you do a laparoscopic repair, they also use a mesh. Because like I said, mesh or hernioplasty is the gold standard. So they put the mesh inside and place it from beneath. Unlike in open, you come from the top because you make your incision here and place the mesh on top. Here, the mesh goes underneath. Okay. Alright, next. Now, if you have a complicated hernia, like the strangulated hernia, I said, you have to do an exploratory laparotomy, which is a major surgery. Your incision won't be in the inguinal area anymore. It will be on the midline in the abdomen. So it's a midline abdominal incision. You open up the abdomen, you explore the contents, you look for any affected bowels. It may include resection of the strangulated bowels. Like I said, if your bowels are strangulated, you have to remove that, meaning you have to cut them out. Resect them. And I actually had a patient like that last month. He was one of the patients I helped. I had to help with the buying materials because he had no money. We removed 170 centimeters of small intestine because it was all black. It was strangulated. All that intestine, only a part of his intestine was trapped in the scrotum, but since the blood supply of that part of the intestine was also in the scrotum and it got strangulated, even the intestines that was still in the abdomen turned black. It was bad. It was bad. But he survived, actually. We resected the bowel. We took out the small intestine that was dead or necrotic, and then we had to put the viable ones back together. We sutured them together. So it's you call that an anastomosis. Yeah, it was really black. Sometimes you have to put a colostomy. Colostomy is when you exteriorize the bowel, or you make a small incision here. You here, you make a small incision on the abdomen, a round one, and then the intestines. It's an intestine that's exteriorized, and then you put a bag. You put a bag over that. There's like a little square here, and you put a bag with a clip. That's where the poop of the patient will come out in. The colostomy. Did it smell dead? Yes, it did. Strangulated bowels smell like dead. It smelled terrible. It was foul smelling. It was really bad. It was that bad. Pretty much like a zombie's bowel, yeah. So, yeah. Strangulated hernia, you need an exploratory laparotomy. It's more complicated. Okay? Alright, next. Recurrence. Okay, this recurrence is one of the problems in hernia. Before mesh was introduced, or mesh was used, you'd have a high recurrence of hernia, especially when it's not tension-free. So, what are the chances of you having a hernia again after surgery? If you had a hernioplasty done, you have a less than 2% chance of having a recurrence because there's a mesh there. You're not supposed to have a recurrence unless there's something wrong with the mesh. If it was a tissue repair, it's higher, up to 10%. Because they do what you call a tension-free tissue repair already. But if it had tension, you'd have a higher rate of recurrence. Okay. And that's the last slide. Alright. I hope you guys learned a lot. Drink coffee, what? Do you put on some kind of menthol on the mask to mitigate the smell at least? Nope. Nope. The last time I operated on a strangulated hernia, I smelled all that for like, what, 3 to 4 hours? 3 hours? Great class, thank you, Teacher Shiori. Gising na kayo, mag-quiz na sila. Okay. I hope you guys learned a lot from that. Doc 1/4 pa. Quiz. Kailangan pa ng quiz. Anyway, do you guys, before we proceed, do you guys have any questions? Maybe you guys have questions. 1/2 vertical or horizontal? Ano ba yan? Gusto mo may quiz talaga? Very informative, dog. Luckily, I don't have a hernia, but I have big balls. Yes, shadow balls. Shadow Matsu has big balls. Hernia equals pain. Teka, di pa ako handa. Sige, gusto niyo ng quiz, ha? Gusto niyo ng quiz? Prepare kayo ng ano. Prepare kayo ng 1/8 sheet of paper. Yellow pad. 1/8, 1/8 sheet yellow pad. 1/8 sheet yellow pad. Wala na. Niremind ko na ako para sa quiz. Question po, Doc. Can pneumonia in childhood cause hernia? Not really. Not really, no. Because pneumonia is in the lungs. Well, if you have a chronic cougher though, like you keep coughing, more on tuberculosis could cause a hernia because you'd be coughing for so long, or how many months. It can increase your risk of having a hernia, but not pneumonia. sheet of paper. Okay. Prepare. Ay, nako. 1/8 sheet. Manda kayo. Oh yeah, I have this kind of hernia that wasn't operated when I was just a baby. I think it was called a hydrocele. Oh, hydrocele is different from hernia. Hydrocele is different from hernia. Hydrocele is when you have like water in or fluid in your scrotal sac. Ang liit naman. Maliit ba? Okay. Gusto niyo lang quiz. Okay, just get 1/8 sheet of paper. And I'll ask you questions. Okay. Okay, question number 1, guys. Question number 1. Question number 1. Pwede ink pen po ba pwede sa quiz? Ball pen ha, guys. Ball pen. Bawal pencil. No erasures. No erasures. No erasures to ha, guys. No erasures. Bawal. So, ball pen. Black ball pen. Okay, question number 1. Question number 1. Alright, number 1. Sino ang pinakamagandang doktora sa Pilipinas? Sino ang pinakamagandang doktora na VTuber sa Pilipinas? Anduredo ako. Belo tayo. Ba't belo? May nagsabing belo, buisit ka. Belo VTuber. Gagi. Mag-apply kaya ako sa Belo, maging VTuber ako ng Belo. Ang mga sumagot ng Belo, wala na, bagsak na sa quiz. Yung mga sumagot ng Belo, bagsak na. 0. Dr. Para. Doc Shiori Belo pa. Wala na, yung mga sumagot ng Belo, bagsak na kayo. 0 na. Wala na. Yung mga nag-Belo, pass your papers. Disqualified na kayo sa quiz. Wala na. Si Hayden ko. Hayden ko, tayo na. May bonus ba sa quiz? Uy, baka nangungopia pa kayo sa nang sagot sa tanong ko. Napakadali naman yung tanong ko. Itlog score. Oo nga. Sino ba yung mga sumagot ng Belo? Teka, marami kayo eh. Marami kayo. Si Orion, nagbelo. Si Mistis Dedalus, Belo ang sagot. Sino pa? Recycled cabbage, Belo. Bagsak kayo. Discord online kopyahan. Number 1 ko, doc correct. Wala, pass your papers na. 0 na yung mga sumukat ng belo. Okay. Okay, guys. Wait lang. Okay na yan. Okay na yan. Okay, pass your papers. Okay na yan. Yung mga sumagot ng Shiori, 100% pasado na. Okay na. Okay na kayo. Hindi pa... Pass your papers na. Hindi pa kayo tapos. Yung mga hindi pa nagsasabit ng papel, 0. Wala nang number 2. Wala nang number 2. O sige, gusto niyo ng number 2? Fine. Okay. Number 2, fine. Bigyan ko kayo ng number 2 question. Para sa mga, para give chance sa mga nag-0 kanina. Bigyan ko ng chance. Okay, number 2, fine. Gusto niyo eh. Ay, nako. Okay, number 2. Number 2. Okay. Last question to Sino? Okay. Sino sa mga mods ko ang malaki ang balls? Okay? Yan yung number 2. Sino sa mods ko ang big balls? Nasabi ko yung sagot kanina kung sino yun. Okay. Ayan may chance na kayo. Ba't si Whitbread? May balls ba si Whitbread? Sino sumasagot na Whitbread? Sadobatsu versus may balls ba si Whitbread? Diyos ko. Sinabi ko kaya kanina yung balls. Sabi ko si Chadomatsu, big balls. may nagsabing Whitbread. May balls ba si Whitbread? Si Whitbread wala namang balls, diba? Ganyan yung itsura ni Whitbread. Ano ba yung itsura ni Whitbread? Ay. Yan yung itsura ni Whitbread. Wala namang balls yun eh. Where are my balls? Where is Bread's balls? Wala. Okay, I'm gonna erase this now. Erase na. Ayan. Wag na, wala na. Okay. Okay, pass your paper. Sino ba nag-perfect? Sinong perfect? Hashtag bread no balls. Sino nag-perfect? Who got a perfect score? Bakit yung iba nasa kantin? Ano yung nasa kantin nagka-quiz? Screenshot lagot ka. Okay. Sige. Wait, at time it's 9:43, guys. Okay, let me announce something, okay? Pass your papers. May announcement ako after class. After class announcement. After class announcement. Guys, may announcement ako, guys. Okay, announcement. We have a We have a movie night tonight, actually, at 10 p.m. We have a movie night tonight in my Discord server at 10 p.m. We'll be watching Matrix Resurrections. So if you guys want to watch, just hang out in the movies channel in my Discord server. See, Chadomatsu will be the one hosting it. Okay. Class, after quiz, manood tayo ng movie. Okay, we're gonna watch Matrix Resurrections at 10 p.m. on my Discord server. So just, if you haven't joined it, just join. If you want to watch, just join my Discord server and then get the movies roll, so you can watch with us. Si Chadomatsu yung host. He's the one hosting. Big Balls Chadomatsu. Okay. Take notes every scene. Baka may quiz bukas. Okay, guys. Thank you everyone for coming to my stream. I hope you guys learned a lot. From my hernia stream. Okay. Baka may assign. Yeah, anyway, Otsupon, guys. Otsupon. Thank you for attending my medical education, my last medical education stream for the year. So the next one will be on January. So topic, medical education streams with a set topic will be here on YouTube, and then free talk medical education will be on Twitch. Okay. Otsupon. Let's oh wait. I almost said let's raid someone, but we're on YouTube. I forgot we're on YouTube. Hindi pala pwede mag-raid dito. Wala palang raid ang YouTube. Otsupon. I'll see you guys later if you guys want to watch Matrix Resurrections. If not, my next stream will be on December 30. Okay, and then December 30 is just the VR chat date with Sir Wheatbread. I'll make a thumbnail soon and a poster for that soon. And then my last stream will be on December 31. Okay. Otsupon. Bye-bye, everybody. Thank you so much for coming to my medical education stream. Goodbye. Goodbye.